Hi team, this is Aaron here to give you a video on how to do a thorough inpatient pre-op. So first of all, we're going to talk about how to do a thorough pre-op. Second is what to do when we have an emergency situation and we can't do a thorough pre-op, and what are the things that we absolutely have to focus on. And the third thing is we're going to discuss talking to the patient, review of systems, things you want to bring up when you actually talk to the patient. So the first part of this video is broken down into 5 areas of Epic you need to visit in order to get the information you need to write a proper pre-op assessment. So here we are in Epic. The first thing you want to make sure is that you're in the correct context. It's UFV anesthesiology. So you click continue. That usually pops up as soon as you log in. You can also go to Epic, change context if you're in the wrong context. When you're at Shands, you can go to More Reports, T+1 PO Print. This is where you're going to find all your information for the next day. Since this is not actually Epic, this is the training version of Epic. There aren't any patients here, so I'm just going to hit TPO just so I can have a patient list. We're going to write a pre-op for Lance Rossett. So step number 1 is to click Pre. That's going to bring you to this screen. And awesome. It is Lance's birthday. Happy birthday, Lance. Accept. All right. So the first thing I like to do is I like to go ahead and get my note started, at least just opening the template. Until I actually see the patient, I click chart review only, just because if, let's say, I get called to an emergency while I'm working through um, chart reviewing the patient, then the next person who comes along and wants to finish it knows that I haven't actually seen the patient. So I click chart review only. It's important to know that just doing a chart review is typically not acceptable. You have to go see the patient unless you have a really good reason not to and finish the pre-op. And here on the left side, you can get some basic information. So I go ahead and just kind of put a little skeleton in here. This is a 20-year-old male. Looks like he has 11 beta hydroxylase deficiency, but he also was in an MVA. After MVA, who is scheduled for exploratory laparotomy. Okay, and then I also, after I kind of put their name or like how old they are, what their diagnosis is, what they're scheduled for, underneath I like to include the medical history. Um, and here I can see he's taking albuterol, so I'm going to go ahead and say asthma on albuterol. And I can see that he's allergic to penicillin. Okay, so that's just kind of getting the note started. We can now go back to the pre-op, pre-procedure tab and start from the top. Okay, this is going to give you all the basic information that you need. So there's the procedure, there's some imaging results that potentially could be there, some basic information, height and weight, vitals, NPO status, airway review. You can see the previous anesthesia records here, but there aren't any. That's super important. And you can see their general problem list. And like I said, asthma. So that seems like he has headaches, had a liver lac. I assume that's from the MBA. So that's important to know and note in your actual pre-op assessment with liver laceration. Okay, so anytime I find like super relevant information, I like to go ahead and just throw it back in my pre-op before I move on to the next thing and potentially forget to put it in there. Because this is all somebody might look at before they take the patient back. So you can always just keep going back, pre-procedure, keep scrolling down, allergies to penicillin. That's pretty much everything for step 1. So again, everything is here in the pre-op tab. It's going to give you a nice basic overview of the case and what's going on. Okay, but we need more information than that. So step 2, this is everything under chart review, okay? So the most important information you can get from chart review is under the notes tab. You can get the most recent H&P, progress notes if they're on the floor in the ICU. That's going to give you a ton of information, like why is the patient here? What exactly is going on with the patient? Okay, you can also find a lot of labs, microbiology, imaging, their basic med list, inpatient, outpatient list. This cardiology tab is great for going over echoes, any cardiology result over time. So if it's a recent cardiology result, like an echo that was done today, I would use a results review. If it's something from 6 months ago, I think it's easier to find under this cardiology tab. Okay. So this is an excellent place to start for just finding basic information on results and notes for the patient. The next step, step 3, is under the summary tab. There are a few tabs in here that are especially useful, and I think the most useful tab is adult overview. If you've been on an ICU rotation, I think this is by far the most useful. Like if I could just pick one thing to look at and that's all I had time for before I went to go bring a patient down to the OR, it would be this. Like this is giving you tons of information in terms of vitals, oxygenation. If they're intubated, it'll give you vent settings, their I's and O's. It'll give you all recent labs and most importantly, or one of the most important things at least, is what access do we have, okay? Looks like we have one left PIV. Okay, well this guy was just in a motor vehicle accident with a liver lac. We're going to need more access. So this allows me to know that we don't have appropriate access, and I need to get ready to get that access. So this is super important, high yield information. And this is very short because it's a training module patient, but these can be quite lengthy with tons of information. Other two tabs that are important to look at is the patient overview. This will give you some generalized information as well. Not nearly as useful as adult overview in my opinion, but something still worth looking at quickly. And then lastly, you want to look at the actual MAR. So the MAR is great because it tells you if they're on antibiotics on the floor. You want to make sure that they don't miss those antibiotics when they're in the OR. Also, it tells you what exactly they're taking. If they've been missing doses, you can see any PRN doses that they may or may not have taken, and it gives you all of their information in regards to medication. So if you are running short on time, under the summary tab, which is our step 3, I would absolutely look at adult overview and the MAR. This is musts, okay? The fourth step is results review. So you can go down here to results review. I just click today's data, and you can get all the results that have resulted recently, and you can scroll back in time, but it's going to give you every result from all different types. So it's going to give you pathology, it's going to give you electrolytes, it's going to give you your CBCs, and this is great for seeing what are the most recent results. What's the most recent ABG say? What is the most recent CBC? And because everything's in chronological order, so this is great, a great tab for checking that out. Also, whenever you find the echo, like you could find the echo in results review or under chart review cardiology, either way, when you have that information for TTE, MPS, left heart cath, PFTs, things like that, make sure you include that information in your pre-op. Just for the sake of putting that information in, you want to put it under the communications tab, so you can either click on the communications tab, type in that information like TTE, let's say it was done today, EF 65%, probably greater, no valvular abnormalities, like hyperdynamic, because it seems like they're volume down, so probably hyperdynamic, something like that, okay? You can either type it in there, or you could go ahead and just paste it below here. Either way is fine, like that, in your actual note, but not in the smart praise. That either way is fine. Also, it's super nice to have an EKG that if they have an EKG available, to put that in the pre-op. So how do you do that? Okay, so you can open up the EKG, go into Snipping Tool. You can just type it in here under search. It should pop up. Click New, and then you can go ahead and scan your EKG like this. What it does is it makes an image of that. Right click, copy, go back to your note, and paste it. And you can paste it in communications. That's a great spot for it right here, and then hit paste. Sometimes it takes a second to load up, but that is how you can use the snipping tool to put anything that you want into the actual pre-op, okay? See, you can actually see the EKG there. Sometimes I use this if I'm in the media tab and I want to copy like a cardiologist note from an outside facility, but it's like a scanned in copy and you can't just copy paste it. You could also use the snipping tool to take that information out and put it in here. The fifth thing that you want to check, and we kind of briefly mentioned it before, is looking under the media tab. Are there any outside documentation? Are there any images of the patient that could assist in the anesthetic care of this patient? You can go through the media tab and actually find that information and import that into your pre-op. Okay. And then one overarching thing that when you're doing all this, if you notice that your patient has an ICD or a pacemaker, so every ICD is a pacemaker, but not every pacemaker is an ICD. So it's important to know, what does this patient have? Okay. You want to go figure out exactly what is the information in regards to this pacemaker ICD. So we want to know, when was it last interrogated? What is the device manufacturer? What mode is it in? What response do we have when we place a magnet on there? We might not know that. What's the battery life? We might not know that. What is the range of the rates? It's an ICD. When was the last time that there was an anti-tachyarrhythmia treatment? When was the last time they were shocked? Is the patient pacer dependent? Now that is extremely important. And you can review the Shands protocol, which I'm going to show now, that talks about what does it mean to be pacer dependent and how do I go ahead and decide what do I need to do preoperatively before a patient with a pacemaker ICD comes to the OR. Do I just need to use a magnet? Do I need to call a rep? Do I just need to have the magnet available? All those things are in this algorithm that I don't have time to go over right now, but it's something that's definitely worth reviewing every time you have a patient with a pacemaker or ICD. That is the basics on how to do an inpatient pre-op. So using that, let's go ahead and make sure we fill this out. This patient's pretty straightforward. Some of the things that we could do is we could add labs here. You can go .lab. It looks like all they had was a CBC. Great. And so you can use that to actually throw the labs in there. You can also hit results review and copy them. Right click, copy paste. That's another way to do it. So whatever your preference on that. We have successfully chart reviewed this patient. There's a couple click boxes here that we could also do. That's fine. You can also do that after you see the patient. So we want to know any recent issues with anesthesia, NPO status, what are their metabolic equivalents. But going by system, neuro, we want to know if they've had strokes, seizures, if they're having pain management, psychiatric history, any neurosurgical procedures that they've had done. Cardiovascular wise, we already talked a little bit about this. CHF, shortness of breath, chest pain, metabolic equivalents, any recent syncopal episodes, any red flag symptoms like chest pain, unstable angina, things like that. Pulmonary, do they smoke? Do they snore? Do they have obstructive sleep apnea? Any history of DVT-PEs? Any lung disease? GI, do they have heartburn, reflux, liver disease? Have they had any small bowel obstructions? In the past, any abdominal surgeries that they've had. GU, what's their renal function? Are they on dialysis? When was the last time they had dialysis? How are they feeling on their dialysis regimen? From an endocrinology perspective, any thyroid problems? More commonly, we deal with diabetes. How's your blood sugar? Are you taking insulin at home? So that is the review of systems. Okay, let's say you are on call and you have an emergency case going in 10 minutes, right? You don't have time to do all this, right? You want to know, so you have to know some things before this case starts. You want to see the patient, obviously. Just go see them right away. Are they NPO or not? What's their airway? Are they intubated or not? Any allergies? That's super important. Like you have to know what the allergies are. Any bleeding disorders? Are they on any anticoagulants? What is their access? Do they have an A-line? Or how are they, if they are intubated, how are they ventilating, right? What settings are they on? And are they on any infusions? Okay, that's super important. Thank you for listening. I hope this helped. Feel free to email with any questions, concerns.